Good morning. I think everyone already wake up, right? This is the first session. Yeah. Shall we just go to the rapid diagnosis? Yesterday we saw all the morphology, but today we will shift a little bit, and I'm sure that everyone know what is a MALDI-TOF. No one raise any hands, so everyone knows the MALDI-TOF, right? So we can skip, right, Dr. Chen? We can skip and we get dance. So we have something that we can wake up all the day long. Here, blah, 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 okay? Then we will go to the principle of MALDI-TOF. May I just share a little bit of the MALDI-TOF? Yeah, what is the MALDI-TOF come from here? So long. Time of fright. Okay, fright. Now we are not walking, we are fighting. We are not fighting, but we are fright. We are flying. And what are we flying? We are doing and investigate the protein profile. Normally we do the morphology, but now we change into the DNA and now we are on the protein profile. So here are the steps. What are they doing here? So this is more than one luxurious house. You can get the Mercedes-Benz instead of this machine. But after you get this machine, you can help so many people. Right? You can prepare one culture here, and you can put at least 24 or 96 or how many cultures that you want to do. You just smear on here, and then you just put some chemical reagent like a formic acid, and then put something that make the ion, right? The catch ion to work after the laser, just here. Boom! After laser here, and then the ion will just spreading, and they have a detector on the top. Only here we cannot do anything, so we need to have some bank, right? Database. If you do not have enough database, or we do not have the good bank, how can we analyze? We cannot do anything, right? It just have something like a pen, nothing else. So here, if all these cultures have the same species, have the same isolate, same strain, they do have the specific peak. But if not, here, Grabata or another species, they will have no any specific peak. So how can we do? So this is the good part. That's why we can separate into the species and genus. This is the good part. So how can we analyze? They will have the mass per charge ratio, yes, to help to isolate for all of this. Normally, for the fungus, you know it's very fussy, very difficult to do it. So you start something that is so cute, only unicellular, and we can control a bit control of the organism. Here, we start with the yeast, with the pure culture. Yeah. To prepare the yeast sample is much more easier to prepare than the mold. Let's see, yesterday we have the wet lab for the yeast, but today will be the mold. So we have to start up to get the energy more and more. So this wet lab in the afternoon, you will get more. Yeah. So everything, almost everything, the yeast will be easier for the mold. But the disease, I'm not sure how aggressive it will be. For the accuracy of the identification, so it depends on the instrument data. Here, I have to disclose that I have nothing involved for of this company. For the multi-biotype, for each brand, each company, they have an accuracy different one. Here is a 100%, but I have no idea which institute or which hospital get this kind of machine. Right? So it's not only the accuracy, but it have to be friendly too. Right? We have to be user-friendly. So here, if anyone want to follow the study and you want to buy with 100% accuracy, you can just try to find this reference and compare. So from the pure culture, the advantage of using the MALDI-TOF, it can overcome the limitation of what? And discriminate with the common biochemical methods, or unidentify the similar phenotypic. Right? This is a very good part of the MALDI-TOF to use it, but have to consider, as Dr. Chen mentioned yesterday, several A. Right? Here, can MALDI-TOF identify the yeast directly from blood cultures that all the IDs, right, all the transplant men, they really want which kind of candida, and not only that, they also want the resistance, right? What is that? The susceptibility pattern. Here, the factor 1, highly abundant substance disturb the identification process. Like the culture, sometimes you cannot pick up the culture, right? You contaminate it or you pick up the media too. So that is some protein inside that made the contamination. The human blood also have so many protein. Here, these components can generate mass peak. So this peak will make the miss. So you do not have only the machine, but you need the skillful of the technology too. Then the challenging purification might help. So here, they try to have several methods, several processes to purify the yeast. Let's see. The second factor is amount of the yeast. Right? If you do not have enough amount of the yeast or organism in the blood culture, how can you identify them? How can you extract enough protein for the analysis? So they need the extra step using the centrifugation. Yeah. So they try to develop more and more. Yes. And this is after this study. Here, several kinds, like they use several machines, and then they put some like extra extraction process, and they try to help. Here you can see after they use several species of candida, but the result is still something that they still need on the process for the development. And here, with this kind of thing, hemoculture from this company, with more process of a differential certification using the database up here, and they can do separate or not. You have to really think about that. Yeah. Here, in summary, direct identification of yeast is possible. Yes, I think several laboratory is on process of doing this one. The purity of analyte have major effect to the result. However, several here, sample purification is available. Protocols for purification used are not yet standardized. So you still have to try in your lab. Research use only. How about directly from urine sample? This is another sample that we want to use it, right? We don't want to use any blood or any invasive specimens. They try to use the yeast also. Yeah. Technically, yeast identification directly from urine is possible. Right? Do we need to develop with the urine? We have to think too how significant it is. So influence of the sample preparation method. So they try to have appropriate for most yeast. However, due to the strong cell walls, as we know, the yeast are even among the same yeast, but different strain, different isolates, the cell wall also different. Let's say this is a yeast is quite different, but how about the mold? It's much more different. So modified procedure are developed. Yeah. This is three main methods that the companies try to do it. From the colony on the agar smear preparation, then rice cell on the target, air dry, and overlay on the matrix. The second one, directly smear. Very easy, right? Very user-friendly. We just pick up the colony, and here we have to clean the cell first using the 70% ethanol, and then here. So three methods are different from each company, from each producer. So you have to really think about this before you're going to buy and before you're going to set up the protocol. How about this one? With the different process of sample preparation, cell extraction have good peak, right? On-target lysis have the good peak. But for the direct smear, it's very user-friendly, but how about the peak? It's not so good. So how can we analyze? Question mark. So for example, Candida gravata derived from each method, give the different pattern of spectra. So for cell do not lyse efficiently, so it is cannot. So this is the way that please consider when you get you have to think when you want to buy from each company and which process, because this one will involve into your database. Okay, and any question? No question, right? So this is a MALDI-TOF biotyper provide both extraction here, and this by provide only this process. So I just give you the information and have to think about this. The on target here, less hands-on time than cell extraction, but the result, the analysis is really have to develop too, have to adjust. Yeah. If we have something, the cut-off point is very high, it is very hard for the real world. So they try to adjust like this. To overcome the fewer peaks generated from this method, the analysis criteria was modified. In general, mass per charge ratio, or the log score of this company, they set up that less more than 2 species level identification, and for 1.7 and up to 1.999 will be genus level only. So they try to adjust the cutoff. Current here, this is the current one of the biotyper. They try to decrease the criteria of the log score here. This is the log score. The starting from 1.5 can be accepted as a species specific for yeast. Then another 3 additional criteria was added. A certain number of database hits at least. It means that if the result after you analyze, after doing the process, after doing the MALDI-TOF, if the sample have when after analyze the result will show you the list 1, list 2, and list 3. The top 2 or the top 3 show the single species, it will be fine, right? With this log score. Yeah. But if have no other species intermingled, if the significance difference of log score to be the next species are less, so forget the last one. So use only the top 2. Yeah. And using this criteria, the accuracy is increasing. Only if the criteria are not met, the sample should be repeated. And another thing, if we got the new species, the new genus, MALDI-TOF cannot help you anymore. So what are we going to do? Sequencing. So you have to be back. Yeah, don't only in the advanced. So we all have to be in the real world. The sequencing is the best, in my idea. More difficult to analyze than yeast, yeah, for the more identification. Here they have several things, diversity of the cell walls also. The melanin pigment is also the interference factors. So to overcome all of this limitation, they try to do the mechanical disruption, the beating protocols and acid-containing matrix solution, and also try not to use the agar that will contaminate, that will interfere the protein. So they use the liquid cultures. So here, more identification is now recommended for research use only, especially in the big laboratory. As Professor Patrick yesterday, is that okay to use a drug resistant experiment? So we're still in the question, right? Actually, what are we doing? Because the result of the antibiotics is not the real world. So it just have something to give you the guide. So shall we doing next? So please think about that. So affordable, the time and the reasonable to do it. here. So everyone try, not most of the researchers, they still try to identify the fungal species and try to do the anti-drug resistant predicted by the MALDI-TOF. How about under prolonged therapy? So they also try to do the broth microdilution and then get the cultures from the broth microdilution and identify the protein. If they do have the hotspots, the enough protein, okay, it will work. But we still, right, less information about the drug resistance for the yeast and mold. So it's another question, is that good or not? And this is another limitation of, out of the detection range of here, the MALDI-TOF can detect only 2 to 20K Dalton. So if you do something more than 2 to 20K Dalton, is that worth enough to do it? Question mark. Today is so many question marks. So they try to do the modified method here. So still on the process. How about the cost effectiveness? Here. Biochemical test. How many days? 3 days. How about MALDI-TOF? 0.5. The doctor will love it. But how about the price to get the MALDI-TOF? How to maintain? Yeah, when they have a problem, who is going to collect? Who is going to help to support the mechanical, the technical one? So here, this is will be the last part of the MALDI-TOF. For the blood sample, they try to do the automate and then purify, whether after the signal from the automate and then use discovery, direct ID, identification, MALDI-TOF, or they have to plate to multiply more cultures and then do the MALDI-TOF, or they're still using the classical way and plating until the colonies and MALDI-TOF. So it depends on how the situation of your lab. Before you're going to start from the blood sample and then directly to the MALDI-TOF. So this is something, some information for you to consider. Yeah, which kind of things, which kind of process is proper for you. Yeah, so I just give you the information for you to consider. Yeah. So shall we shift from the MALDI-TOF to the antigen? As you know that normally for the mold, yeah, we will detect antigen or antibody. Everyone's sleeping. What we are going to detect, antigen or antibody? Help me, please. Antigen. Thank you, Jiong. Yeah, we are going to detect antigen, right? Because antibody is not so active. So here. But before we detect that, see how many burden of the fungal infection. A lot. This is underestimate. And especially in Asia, we do have, except Taiwan, they have very good epidemiological study. In Thailand, it's really something. Now, you can see this. 1950, we already using the immunological process. The advantage, it can be positive when the culture results are negative or the sample are difficult to obtain. And 50% of the seropositive sputum with the chronic aspergillosis are culture negative. So sometimes it's very difficult to get the culture. So serology will help us to guide something, but it's not a strong evidence. So normally we need some evidence together to consider together with the clinical symptoms, but the disadvantage. Some of the immunocompromised hosts still have the immune system, right? Have something. Yeah. And inability to distinguish between current and previous infection, except for some ID, like a histoplasma that have H and M band. Yeah. And some band will show you that which one is active and which one is inactive. Sensitivity is dependent on the type of disease and the timing of testing relative to the disease process. So all the yeast and mold still have so many things to ask, so many things to observe, and so many things to monitor. So what we are going to talk today, so many questions here. This is not so updated. In 2010, they try for the candidiasis. I'm going to talk to each important disease like candidiasis. The diagnosis of the invasive candidiasis is high-risk patient. And still, how can we do it? So the European Conference on Infection in Leukemia, they try to set up something. They try to use the mannane and anti-mannane antibodies to overcome or try to do something that can guide the patients. And so this study have no control and very diversified study. 14 study that comprise of 453 patients and 7 something controls. 7 studies have involved in the hematological and cancer cases, and another 7 is ICU and surgery. No control, and all the study have a different process. So just some guide. I would like to show you that this is the guiding, because this is the retrospective. Sometimes we cannot do the prospective. The moderate sensitivity and good specificity of mannane and anti-mannane show 50%, 60%, and 98%. And when using only the anti-mannane is here. But after combine as a team combination, the better show sensitivity up to 83 and specificity 86. How about different causative agent, different species here? So it shows something. So you cannot use it as a hardcore to identify, right? To diagnose, but it can help you something, to guide you something. How about next? The cryptococcus. Everyone know the cryptococcus, right? Yesterday, you can see the melanin pigment on the calcific acid. You can see the urease can show you the genus. You can see how to differentiate the variety, but it takes time. The doctor cannot wait. So they use the latex agglutination test, or use if you have the fluorescence, they use the FA. Now everything is too slow. Just less than 15 minutes. Now it's already POC, right? Point of care. LALFA. Actually, it doesn't involve anything. I just saw this morning. LFA. What is LFA? Dr. Sun is sleeping. Dr. Sun, wake up. It's a lateral flow assay, right? So it's a very fast, 15 minutes, and it can show you the control and also the positive band. This is already the WHO recommendation. I think everywhere, every hospital in here and also in China, you already use LFA. It costs about 150 baht. Might be about $5. I don't know how about in here. But however, for the cost, in our hospital, we use only for screening, not for the titer, because it's too much expensive. We cannot affordable. So after we get plus or minus, and then we do the latex agglutination for the titer. This is what we practice. Here, they can show you any specimens, serum, plasma, CSF, or urine. Or if you have the rich laboratory, you can use this strip for identification too. You can use for the cryptolaurentia, you can use for the Candida albicans if it gets negative. So something like this you can apply if you have just the budget. Latex agglutination. What is the latex agglutination? It's the beads with the polyclonal coat to detect the antigen. We're still in the world of antigen, okay? Now we go to another for the aspergillosis. You remember what is the aspergillosis? That have the microphone head, right? The vesicle. Whenever they show the vesicle, it will be aspergillosis. But so cute of the head. But actually, the disease doesn't cure anything. Right? No, up to it can up to the here, up to the right from the head to toe. Yeah. All infected. Also allergy. So how can we identify that? The major, you can see from now on, everything just come from the cell wall of the yeast of the mold. So everything from the gate. Now the scientist is very clever. Yeah. So we have to observe what is this gate, what is this door composed of before we open the door. So now we come to the Aspergillus. The door of the Aspergillus, the outside door, is the Galactomannane, GM. But unfortunately, recently, the Galactomannane have only monopoly from blah, 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 blah company, right? But right now, they have in China that you can have up to the quantification, like up to the nanogram or picogram, but I'm not sure for that. And the major component, it has a cross reaction with the Penicillium, Physellomyces, Fusarium, Histoplasma, and Pneumocystis. Anyone who used GM, please raise your hand. Oh, no hands. Oh, Betty, thank you. Okay, so most of here also use the Galactomannane. But you can see that even Galactomannane already started so many years ago, but no definite, right? Still have to apply, still have to interpret. So I do not need to show this one. So this is a normal ELISA technique. It seems very easy, but actually the technical still have the problem. If you use, in our experience, sometimes in one box, they have two kits together. And if you switch from this box and use the reagent in another box, the cutoff will have a problem too. So try to fix. I don't know how the company do. We will be discussed about this thing, but they say, please do not switch the reagent over the different box. Here, FDA approved as a diagnostic aid for the IA. This is one thing. When you do the Galactomannane or EIA formed by a rat, still have the problem, right? This is a semi-quantitative. They have the cutoff too slow. How many hours for this one? Half day. You don't write, right? It's too slow, eh? Yeah, he's smiling. It's not enough. So how can the serum, the specimen, can see it show as an index, the correcting specimen at least twice per week. That is the USA recommend. How can Asia do that? No. Do you do that? No, right? Less people. It costs a lot because the patient has to afford that. Yes, okay. So aspergillosis, you have a specific here, IgG, blah, blah. Okay? Galactomannane. So they try to specify for the specific patient and not only the EIA. Now they have many companies that try to produce more. Still on the process too. How about the lateral flow, invasive aspergillosis? Only few minutes again. Less than 1 hour, you can get it. And the result right now show much better. They have the control, they have test line here. It is a semi-quantitative here. I don't think in Asia they already import. It's still in Europe and USA. Yeah, we will try. We will try to fight to get this for our patients. And the last one, I think this is a histoplasmosis. I heard from Taiwan it's not much. So this one might help, but how to get the IMI antigen, this is another problem because Asia has a small market. So I have to ask Professor Lee to help us to get a histoplasma for Asia. And the result quite good. For the disseminated case, 95%. For the acute, 80%. For the chronic, forget it. For the chronic, we can do the direct examination. We can do the culture. Right? Now, it's the beta-glucan. The last one, the beta-glucan. What is the beta-glucan? The beta-glucan also the cell wall of the yeast and of the mold, the septate mold. So if it can identify, they have from US, from Japan, and how to analyze the data and how to process is different. And for the Fungitel Capcot from USA, it is the FDA approved to diagnose the deep-seated mycosis and fungemia. I also have nothing involved with this company. And EORTC also approved this one. What is this? It's from this kind of animal. Yeah. Normally we use as an endotoxin, right? Lipopolysaccharide and have this process. But for the beta-glucan, just shortcut to stimulate the factor G and become this one. And then have the synthetic peptide using the ELISA and show the, what is this? It's a reaction that we have to observe the timeline here. And we analyze using the data, the Gen 5 is not so cheap. It has a costly too. Yeah. How about the sensitivity and specificity? The serum quite good, but not only one time. You do have to analyze at least twice, and it's costly. If you do only one sample, it's not worth to do that, because one kit you have to do, one tray you have to do 20 samples. So how can we wait for the result? So unfortunately, BD is not pathogen specific and cannot differentiate fungal species, but it can help us to indicate, to guide. If the BG is positive, it will be pneumocystis, it will be septate hyphae, it will be yeast. So after that, we can use the same sample and then process or test with the galactomannan or mannan. So we can differentiate which kind of disease it should be. However, even this is very sensitive, but the cross reaction still with the bacteria, show like this. And with the high sensitive, non-infectious disease, how to correct the specimen? How about the patient also have some interference to the test? I think I'm going to finish with this cell wall structure. Yes. So scientists, not only for the detection, not only for the monitoring, but also for the drug target, they're just using something like this, like here. Beta-glucan is here, 1,3 beta-glucan. Galactomannan for the aspergillus. So you can see the different colors of the structure, of the cell wall structure. And recently, just last night, very exciting because they just have the papers on using something that we think it is not useful, like a 1,6 beta-glucan. They use the 1,6 beta-glucan that is common in all the organism and use this 1,6 beta-glucan to identify all the causative agent. So it is some way that we can help the patient that they use the common one to identify the fungal infection. And then after you know the fungal infection, then you can differentiate each disease later on. At least you do know which kind of microbe is the pathogen. Okay, I'm on time, right? Thank you.